hip replacement surgery has been done since the 1890s, which was over 130 years ago. And over this period of time, the art of replacing hips, the materials that we've used has certainly changed a lot and drastically. So when I was a junior surgeon training in orthopedic surgery, I was taught by my learned professors on how to do this procedure, and this was done through the posterior approach. When we do the traditional approach to hip replacements through the posterior approach, we do have to split or detach about 4 or 5 muscles from the bone itself in order to perform the hip replacement. These muscles are then repaired. The benefit of doing this surgery through the posterior approach is that because it's a very large skin incision where the muscles detach, we are able to see a lot of the hip, including the rest of the nerves, the muscles, the capsules, and the bone that we are about to cut. The downside of this procedure is that the structures in the back of the hip are essentially compromised. This means that when patients sit or squat, there's a risk that these implants may dislocate backwards or dislocate posteriorly when they are squatting, kneeling, or even crossing their legs. As such, we often ensure that patients take the necessary hip precautions for about 6 months to a year after their surgery. They are allowed to walk and climb stairs, but certainly they are discouraged from squatting, kneeling, or crossing their legs. When I embarked on my orthopedic fellowship in 2017 in Melbourne, I was taught a new way of performing this hip replacement. Rather than entering the hip from the back, we enter the hip from the front. The skin incision is in their groin and it's about 10 centimeters. There are many muscles in the front of the hip, but unlike the muscles in the back, which are cut, these muscles in the front are just pushed to the sides so that we can access the hip. The benefit of this operation is multifold. Firstly, because we do not cut any muscles, these muscles are kept strong and patients are encouraged to ambulate or walk as soon as their surgery is over. After about an hour or two after surgery, they are allowed to have their lunch and drink some drink before they start on their physical therapy and physiotherapy. Because we don't cut any muscles, we lose less blood during surgery. So most of these patients having the anterior approach hip replacement do not need a blood transfusion after their procedure. And finally, because we don't cut muscles, patients' pain after surgery is much less than before, and they don't need heavy painkillers after surgery, and they are encouraged to ambulate or walk as soon as they wake up from surgery. So most of my patients who've had the anterior approach hip replacements, they walk within 2 or 3 hours after their surgery. Initially, they walk with a walking frame, and within 5 minutes of walking, they are downgraded to a walking stick. They usually go home, they are usually discharged from hospital with a walking stick. The benefits of this is multifold, and on an economic level, these patients only need to be admitted to hospital for 1 night. Using the traditional methods, my patients used to be admitted for 4 to 5 nights in hospital. So the reduction in general hospital stay is significant, and this actually translates to millions of dollars saved per year.